So let's start with bringing it all front and center right now today with Dr. Christine Kimble. Tell us just in a few words a little bit about your background, because she is with the Ohio State University.
Yes, I am with the College of Nursing, and I do have to state that the views and opinions expressed here are strictly my own and do not reflect the official position, policy, or endorsement of the Ohio State University. My participation in this wonderful podcast is in my individual capacity and is not representative of the university or its leadership. So my background really started when I was a burn nurse. I would see patients come in and sometimes their, sudden injury was too severe to do surgery. And I saw the families, the patients, the doctors, even the nurses really struggle to have those difficult conversations about what to do next, whether or not to do comfort care, to bring palliative care in. I saw that people didn't have a plan. So that was really my drive for doing research, to really help people have those difficult conversations. And I think it's so perfect to talk about ovarian cancer, because even if we don't have cancer, we're not aware of our risk, it's really important for us to, as a family, be able to talk about health and be able to talk about our experiences in healthcare. So I'm so excited to be here today and to hear the powerful stories of, we're all women here and we've all experienced good things about healthcare, but we've also seen how healthcare can sometimes let us down. So I'm really excited to hear your stories, and I'm really here to listen and learn from you, as well as provide some of the up-to-date guidelines on ovarian cancer as well.
So that is such a wonderful intro, and thank you for the disclaimer. Yes. And that disclaimer echoes clear over to me, your host, Ladee Pamela, as your intellectual thug. We're presenting voices and perspectives. No indictments. We're not accusing anybody. We're just trying to flow with the flow and give you some information and tell you, come in this space and be 10 toes down. Come on, somebody.
That's right.
And get your ears up and hear something. Yeah. And I just want to add as a footnote, if you conclude at some point throughout the podcast that we're talking something you don't believe in and you think is trash, be reminded, today is not the day to take the trash out. Stick around and listen. So, Dr. Christine, give us some of the data that ties into ovarian cancer. We already know that it is the silent killer.
It is, absolutely. So, and I again want to disclose that a lot of my work isn't necessarily in any one type of disease, which allows me to learn more and more about different conditions and how something called shared decision making, where it's really in contrast with historically where the decisions were made by the doctor and not by the patient. So really it's about making those decisions together, making sure that any treatment decisions are made with the patient's goals, the family's goals in mind, so that it's centered on the patient. So in terms of ovarian cancer, it is the 8th leading cancer and cause of cancer death for women.
I want you to say that again, because somebody came in this space and they didn't put 10 toes down. I want you to put all them toes down and get 2 ears up.
Okay.
Say it again, Dr. Christine. It's what?
It is the 8th most common cause of cancer and cancer death in women.
Wow.
Unfortunately, most times it is caught in the late stages of cancer, either stage 3 or stage 4. Unfortunately, there is no reliable way to screen for it, because typically women will come in with abdominal pain, they'll come in with urinary tract infection symptoms like urgency. We've all experienced UTI before. But so if you're coming into your doctor, they're probably going to say, oh, you probably have a UTI and give you antibiotics. So it's unfortunately something that can go without really being detected.
So, Dr. Christine, just so that our listeners, because we're targeting the academic elite scholars, and along that same trajectory, I'm looking for the possibly revolutionary scholars that want to be out here and help change the landscape of health and wellness. So tell us what a UTI is again. Just give us the full name of what a UTI, because men and women can get them. Don't play today.
That's true. It is more urinary tract infection.
There it is.
Yes, it is more common for women because we have a shorter pathway.
That is correct.
For the bacteria to go. Typically, the urethra is not a space where there is bacteria, but our skin and the areas around our skin have good bacteria it that can sometimes travel up into that area. So for a woman coming in, it's not uncommon for them to be complaining of feeling urgency, pain with urination, and then to get diagnosed with a urinary tract infection. Typically they have to, take some urine and test it and confirm that there is bacteria in there before they give you antibiotics. But that's what makes ovarian cancer difficult to detect. And they typically say there are some ways that they test. They do a blood test for let me look at that. Sorry, again.
No, do your notes.
I'm going to rely on my notes.
Absolutely.
It's called CA-125 blood test, and it's a level of a cancer antigen, a protein that is often increased in ovarian cancer cells. But unfortunately, it can also be increased when someone is on their period, or if they have pelvic inflammatory disease or endometriosis. So that is why women really need to have symptoms before they're going to test for it. We can also talk about some of the risk factors as well, but I also don't want to dominate. But
that's a good segue.
Yes,
and
absolutely.